to temporary Ebola-related entry restrictions. The Kenyan government had lodged a strong protest against Israel's decision to place travel restrictions on passengers from Kenya over Ebola fears. Linda Alela has more.
Kenya has expressed dissatisfaction with Israel's decision to list it among nations facing travel restrictions following the recent Ebola outbreak in the region. In a directive issued on June 10th, Israel authorities named Kenya alongside the Democratic Republic of Congo, Uganda, Rwanda and South Sudan as countries whose travelers would face restrictions when seeking entry into Israel. The Epidemiology Division said in a statement that is actively monitoring the situation and holding regular professional situation assessments led by senior health officials that the ministry is working to reduce the risk of Ebola while ensuring hospitals are ready to respond. Under Israel's new measures, airlines have been instructed to deny boarding to any foreign passenger who has stayed in or visited any of the listed countries within 21 days before traveling to Israel. Israel authorities cited concerns over possible exposure to the Bundibugyo strain of the Ebola virus, which has been linked to the current outbreak centered in the Democratic Republic of Congo. Foreign Affairs Principal Secretary Korir Sing'oei criticized the decision, describing it as unjustified and inconsistent with Kenya's efforts to support regional Ebola surveillance and response initiatives. PS Sing'oei noted that Kenya has conducted more than 80,000 Ebola-related tests without recording a single confirmed infection. The government argued that Kenya's inclusion on the restricted list unfairly penalizes a country that has remained Ebola-free despite playing a key role in regional disease monitoring and preparedness. Government is seeking a review of Israel's decision, arguing that public health measures should be guided by scientific evidence and the actual disease situation on the ground. Israel has since accepted to make the adjustments. In a statement, they say, "We are pleased to announce that Israel's Ministry of Health has decided to remove Kenya and Rwanda from the list of countries subject to temporary Ebola-related entry restrictions." Meanwhile, Congolese authorities have reported one of the highest increase in Ebola cases in one day, as weak contact tracing, insecurity and funding gaps continue to hinder the response a month after the outbreak was declared. The Congolese Ministry of Health said Sunday 72 new cases were reported in a 24-hour period, bringing the total number of confirmed cases to 782. This includes 181 confirmed deaths and 32 new deaths were confirmed. According to the World Health Organization, as of June 13th, a total of 695 confirmed Ebola cases had been reported in the region, including 676 in the Democratic Republic of Congo and 19 in Uganda. The outbreak has claimed 138 lives, while dozens of patients have recovered. The Ministry of Health says Kenya remains at high risk of importing the prevailing Bundibugyo Ebola virus, currently ravaging some parts of the DRC and Uganda, which have recorded 141 deaths so far. According to the Ministry of Health, though the country is considered high risk, systems are in place to contain its entry and management.
The extensive population mobility with the DRC and Uganda, which have reported 635 cases and 19 cases respectively. So while Kenya currently has 0 cases, our rapid response teams must remain fully mobilized.
The restrictions come as neighboring countries continue to battle cases linked to the rare Bundibugyo strain of the Ebola virus. A US-supported 50-bed Ebola quarantine and treatment facility is currently under construction at the Laikipia Air Base in Nanyuki to support response efforts for personnel exposed to the virus in the region. For TV 47, I'm Linda Alela.
President